بسم الله الرحمن الرحيم.
أنا بس عايزة أتوجه بالشكر للدكتورة سوريا الشرقاوي وللدكتور أسامة عرفة، ونبارك لهم على المؤتمر الجميل، وكل سنة إن شاء الله أحسن وأحسن. معانا دكتورة عزة عبد الحميد هتقدم لنا تشايلد أبيوز Clinico-Radiologic pattern in non-accidental trauma. اتفضلي يا دكتورة.
مساء الخير عليكم جميعا. شكرا دكتورة. طبعا لازم اشكر الاخ العزيز دكتور اسامه عرفه على دعوته الكريمه. انا عارفه انكم تعبتوا، والحقيقه الدكتور ماجد الشيخ كان عرض افلام كرتون. انا ما عنديش افلام كرتون، بس عندي افلام اشعه. تنفع ولا اوكي؟ تمام اوكي. يعني هنحاول نتكلم بسرعه. imaging of pediatric non-accidental injury في قول آخر child abuse. During this talk we will highlight different clinical presentations of child abuse and mechanism of trauma, and we will describe the imaging features of inflected skeletal, neurological and visceral trauma patterns in cases of non-accidental injury. Studies show that at least 10% of children under 5 years old who are brought to the emergency room with alleged accidents have actually suffered non-accidental trauma. Health professionals are mandated by law in USA to report suspected abuse within 48 hours to Children's Protective Services. Radiologists are often the first to suspect non-accidental injury or child abuse when confronted with particular injury patterns, so a knowledge of these patterns is essential if the opportunity to save a child from future neglect is not to be missed. At the same time, it's essential that suspicion is not raised inappropriately, not to accuse an innocent parent or guardian. Actually, the historical background of child abuse was mentioned in the literature by the American pediatric radiologist John Caffey, okay, who described 6 infants with long bone fractures and subdural hematomas. So the child abuse is always referred to radiology. In 2001 at USA, an estimated about 1 million children were victims of maltreatment, including parents, guardian neglect, physical abuse, sexual abuse, psychological maltreatment, and medical neglect in descending order. The mechanism of non-accidental injury could be explained by the shaken infant syndrome. Okay, الهزهزة الرجرجة بتاعت البيبي دي very dangerous, which induces brain injury due to acceleration deceleration forces. Chest is compressed, resulting in rib fractures with corner metaphyseal fractures or bucket handle fractures in the arms and legs. Okay, this is your role as pediatricians. To suspect the child abuse from the clinical features. Number 1, injury in non-ambulatory, totally dependent child. 2, incompatible injury and history. 3, delay in seeking medical attention. 4, multiple fractures with no history of osteogenesis imperfecta. 5, retinal hemorrhage. 6, torn frenulum. And 7, history of household falls resulting in fractures. Fractures, okay, are not common with the household falls. Now, when you are suspecting child abuse, if you are suspecting skeletal injuries, you should ask for skeletal survey and don't do or ask for babygram. Babygram is not an acceptable substitute. Bone scans are indicated to detect radiographically occult fractures and should be considered when clinical suspicion is high. Skeletal survey consists of skull, spine, chest, oblique ribs, abdominal X-ray, both upper and lower limbs. And here are the sites of fractures, bucket handle or corner fractures, as I will show you later, ribs, acromion, spinous process, sternum, and occipital impression fractures. In neurological injuries, you should ask for skull X-ray, CT and MRI, thoracic and abdominal injuries, CT and ultrasound. Let me show you the cases. This is case number 1, young child X-ray at clinical suspicion of rickets. Here is the corner metaphyseal fracture, which is very specific for child abuse. So when I write this sign in my report, you should go back to the child again and look at the clinical presentation and the surrounding circumstances. This is very specific. So metaphyseal corner fracture is highly specific for non-accidental trauma. Case number 2, age 2 months, female, presenting with unexplained crying and irritability. Vague history, 2 months. Again, this is what we call it the metaphyseal lucences, and corner metaphyseal fractures, very specific. Of course, with a history. Case number 3, 6 weeks, female. Mother noticed her to be irritable after fall from bed while changing the diapers. And we found this spiral, very long fracture on the right femur. Okay, the baby is only 6 weeks. So why do we suspect child abuse in this case? Diphyseal fractures are not like metaphyseal fractures. They are non-specific. They do occur in both accidental and non-accidental injury. However, in these cases, the age of the child and the history become very important. A fall out of a bed will usually not produce a diphyseal fracture. In order to break a femur, you have to fold it with enormous power. Also, spiral fractures are a result of twisting forces, which are uncommon in accidents in young children. So we suspected child abuse and ordered bone isotope scan to look at other sites of fracture. الحقيقة مش عارفة مش معايا laser pointer. I'm not sure ده شغال ولا لأ. Yes. Okay. Here is the hotspots here, posterior right ribs, indicative of other fractures, which was also what we call it the compression fracture. لما بيعمل child abuse بيمسك البيبي يعصره ويضغط عليه جامد من الايه؟ من الريبس. Now look at the right femur. Where is the fracture, the spiral fracture that we already saw it in the X-ray? Why we cannot see uptake? The lack of tracer uptake around right femur is explained by the displacement of the femoral fracture, which may have prevented osteoblastic activity. Case number 4, 4-month female, child with multiple fractures with no family history of osteogenesis imperfecta or trauma. Okay, look at the fracture at the right humerus and the right tibia. This is very suspicious because the baby have no history of trauma. Male, mother noticed buggy swelling in scalp. The baby is 11 months, barely walking. So we found a very specific finding here, which is a fracture that is traversing the lambdoid suture. This is also another suspicious. A skull fracture traversing the lambdoid suture in a child of this age, barely walking, is unusual, and together with the absence of an appropriate history from the parents concerning for non-accidental injury. Patterns of skull fracture that suggest child abuse are multiple eggshell fractures, البيضة المفشفشة, occipital impression fractures, and fractures crossing sutures like this case. 3-month female, unconscious infant. Okay, we found this brain edema on the left side and subdural hematoma. Okay, and this is the MRI finding of the same baby. The history were inconsistent with the given history injuries, and the patient was admitted to ICU dying. No history of trauma. This is very severe to be just a fall from table or bed. This 5-month-old boy was admitted to the hospital in a bad general and neurological condition with unclear causes. Child was raised in a foster family اللي هم adopting family. Okay. Okay, in the CT, look at the bilateral subdural hematomas. But the clue is in the MRI. Look at the hematoma on the right side and compare it to the left side. It appears here dark, and on the left side it appears bright. This is a sign of this is what we call it deoxyhemoglobin, and that one here is methemoglobin. This one indicative of subacute hematoma, and that one here of acute hematoma. And this is the clue here. So subdural hematomas with different ages are highly suggestive of child abuse. History supported the diagnosis, and the adopting parents didn't show any concern for baby's condition. This is another sacral fracture with this dislocation. لما خدنا الهيستوري كان الأم بتهشك البيبي لفوق وبتنزلها في السيتنج بوزيشن، فراحت عامله لها المنظر الرهيب ده. Okay. This is wedge fracture. Can you imagine that this is because of shaking of the baby? Just الهزهزة الرجرجة التهشيك بتاع البيبي عمل لها this wedge. Okay, look at the normal vertebral bodies here, and this is the wedged fracture. So this is very dangerous. So also visceral trauma. A 6-year-old boy who was beaten by a caretaker. Okay, this is barium male, and there is a filling defect here in the duodenum. It's very also one of the signs of child abuse. This one here, perforation of the bowel. That one is laceration of the pancreas and laceration of the liver. Okay, so it's estimated that 2 to 10% of all abdominal injury results from child abuse. The mean age of these children is about 2 years. The mortality rate is 50% due to patients and doctors' delay. ما حدش بيتوقعوا. These children presented with peritonitis and sepsis, which are the main reasons of death. The history given by the abusers usually does not correlate to the symptoms. The most common non-accidental abdominal injuries are visceral perforation or hematoma, liver and pancreatic laceration, and adrenal bleeding. While in accidental injuries, splenic and renal laceration are unusual in the abused children. Okay, to summarize what I said, our role as radiologists, pediatricians, and emergency physicians is to increase our awareness of the existence of child abuse, detection rate of occult non-accidental injury, suspicion of the non-accidental injury in certain cases, and which make us be able to report child abuse, but be careful not to accuse an innocent person. So you have to know the differential diagnosis of non-accidental injury, of course accidental injury. This is a newborn, and we found these multiple rib fractures, but the cause was due to the overweight of the baby. He was macrosomic, and this is the main reason for these fractures. Also osteogenesis imperfecta. In osteogenesis imperfecta, you see bowing, lytic lesions, and the multiple rib fractures. Menkes disease. Okay, where you can see these hooks here in the metaphysis, metaphyseal dysplasia, and Cafe disease, where we can see these thick periosseal reactions. Now, what about Egypt? Okay, كل اللي فات ده كان موجود في الليترشر ومذكور في الشايلد ابيوز لانه من التوما اكس من الحاجات السبجكتس المهمه قوي بره. لكن what about Egypt? I googled the question. Child abuse in Egypt. I had these results about 2,309 cases, 9,000 cases, 90,000 cases. بس الحقيقه كانت معظمها كلها حاجات سايكوسوشيال، عماله الاطفال، التشرد، زواج القاصرات، الضرب في المدارس، حاجات كلها الطفل اللي كلنا شفناه على السوشيال ميديا، المربيه مش عارفه بتهزه ازاي، الطفل اللي كان بتحميه الست بميه ساقعه في التجمع وكل الناس شافته في السوشيال ميديا، يعني كلها كده. بس ما لقيتش اي حاجه خالص عامله ولا اي شغل منشور عندنا عن موضوع الايه الراديولوجيكال وفيزيكال ابيوز. So I do recommend that joint research study between radiology, pediatrics, and emergency departments about clinical and radiological presentation of childhood non-accidental injuries in Egypt is a good project to suggest. After that kind of research, we may discover other presentations or add newer radiological science. It's worth trying. Thank you. ده الطفل اتعرض للابيوز فبيكلم الابيوزر بيقول just because you deny the abuse doesn't mean I will ever forget. لانه فعلا الفيزيكال injury will heal, but the psychosocial injury will never heal. Thank you.
أيوة. شكرا دكتور عزة على المحاضرة القيمة. بحب بس أفكر أساتذتنا اللي موجودين إن شاء الله رابطة أطباء أطفال دمياط المؤتمر رقم 21 إن شاء الله في مدينة راس البر، المدينة الساحلية الجميلة، والأكل بتاعنا الحلو قوي بإذن الله في الخميس الثاني من شهر 9، وفي انتظار حضراتكم جميعا، وهيكون في نوتيفيكيشن على الفيسبوك وعلى الواتساب للناس كلها تشرفونا بإذن الله. شكرا.